Black fungus causes, risk factors, and complications. Black fungus mucormycosis is a rare but serious fungal infection caused by a group of molds called mucorales. These molds are commonly found in the environment around us, such as soil, bird droppings, decaying vegetation, and manure. Classification and characteristics. Rhinocerebral mucormycosis. This is the most common type, occurring when the fungus invades the nasal sinuses and paranasal sinuses. It usually starts from a break in the skin, such as a burn, scratch, cut, surgery, or skin trauma. Classification and characteristics. Disseminated mucormycosis. This type occurs when the infection spreads through the bloodstream to other parts of the body, mainly the brain, spleen, heart, and skin. Classification and characteristics. Gastrointestinal mucormycosis. This type is less common and usually occurs in people who are critically ill or on immunosuppressive medications. Risk factors. Uncontrolled diabetes. High blood sugar levels create favorable conditions for the fungus to grow. COVID-19 infection. COVID-19 patients are at higher risk of black fungus due to weakened immune systems and the use of corticosteroids. Risk factors. HIV/AIDS. Weakened immune systems due to HIV/AIDS make the body susceptible to fungal infections. Cancer treatments like chemotherapy and radiation therapy can weaken the immune system, increasing the risk of black fungus. Risk factors. Organ transplantation. Organ transplant recipients have to take immunosuppressant medications, which increases the risk of fungal infections. Risk factors. Stem cell transplantation. Similar to organ transplantation, stem cell transplantation also requires the use of immunosuppressant medications, increasing the risk of fungal infections. Neutropenia. Low neutrophil count makes it difficult for the body to fight off infections. Risk factors. Long-term steroid use. Steroids suppress the immune system, making the body vulnerable to infections. Intravenous drug use. Using dirty needles can lead to fungal infections. Hemochromatosis. High levels of iron in the blood can create favorable conditions for the fungus to grow. Risk factors. Malnutrition. Malnourished bodies have weak immune systems, making them susceptible to infections. Metabolic acidosis. This condition increases the risk of black fungus. Risk factors. Premature or low birth weight infants. Newborn babies have underdeveloped immune systems, making them susceptible to fungal infections. Symptoms. The symptoms of black fungus depend on the site of infection. Some common symptoms include rhinocerebral mucormycosis. Swelling, redness, and pain in the face and around the eyes. Unilateral nasal discharge. Loss of smell. Headache. Eyelid swelling. Protrusion of the eye. Disseminated mucormycosis. Fever. Chills. Severe headache. Vomiting. Loss of consciousness. Gastrointestinal mucormycosis. Abdominal pain. Vomiting. Diarrhea. Blood in stool. Diagnosis. Doctors will rely on symptoms, blood tests, and tissue biopsies to diagnose black fungus. Examination of tissue under a microscope can identify the type of fungus causing the infection. Treatment. Black fungus treatment includes antifungal medications, surgery to remove infected tissue, and supportive care to improve the patient's health. Prevention. To prevent black fungus, you can manage diabetes effectively. Avoid contact with soil, bird droppings, decaying vegetation, and manure. Maintain a clean living environment. Drink plenty of fluids and eat a balanced diet. Prevention. Maintain a healthy immune system by eating a healthy diet, exercising regularly, and getting enough sleep. Note: black fungus is a serious fungal infection that can be fatal. If you have any symptoms suggestive of black fungus, see a doctor immediately for timely diagnosis and treatment.